Here is the data from European Wellness Biomedical in treatment of ASD with targeted cell therapy. This data has been collected during the pandemic time and covers 2010s, so it does not include the last 2-3 years yet, which will be included and analyzed in the next report. So we had 44 patients, 37 boys, 7 girls. The age was from 4 years to 26 years of age, with mean age 6-7 years old, and second peak is around 10-11 years old. Patients were from 15 countries, had total of 85 stem cell implantations. The number of sessions varied from 1 to 7 sessions of cell therapy. One session was done in 25 cases, and the rest 19 had multiple xenografts. Here are the relevant charts showing the demographics, the gender, age of the recipients, number of treatment sessions in the cohort, from 1 to 7 sessions. Among the main outcomes of the treatment should be mentioned improvements in the domain of social relationships and reciprocity, improved eye contact, social smile, and reaching out to others, improvements in cognitive aspect, better attention, concentration, faster time of response, improvements in speech and language patterns, reduction in echolalic speech, engaging in stereotyped, repetitive use of language, production of infantile squeals and unusual noises, inability to initiate or sustain conversation with others, inability to grasp the pragmatics of the conversation, and speech regression. So all of that was pretty much improved. Decrease in inappropriate emotional responses, exaggerated emotions, engaging in self-stimulating emotions, plus improvements in concentration, sitting tolerance, attention span, sleep, eye contact, social interactions, as well as notable improvements in the memory. Score assessment showed progressive improvements as well during the 6 to 12 months post-treatment. Overall general condition of the treated subjects as well as the parameters of general health were very much improved. There were less gastrointestinal tract symptoms, less frequency of viral episodes throughout the year, less respiratory tract infections. All the procedures were well tolerated without notable adverse reactions. Now, to illustrate the outcomes of targeted cell therapy, I'd like to propose few case presentations for your attention. A boy, 10 years old, typical presentation of ASD with repetitive behaviors, speech delay, unable to read, learning disability, restless, anxiety, easy get scared, avoiding any social contact or interaction, insomnia. All the dietary adjustments, supplements, speech and social therapy ongoing for years back in a home country where the patient's family is from. Came to European Wellness for 2 weeks of intensive treatment protocol with precursor stem cells, ozone insufflation, transcranial stimulation, hyperbaric oxygenation, electromagnetic and sound therapy, followed by the MO, the mitoorganal CNS, MO pineal gland, GCMF forte, 2 full cycles, 8 weeks each with 2 months break, rest in between was done. The changes observed during the first months after treatment. According to mother's observation, the child became much calmer, sleeps well without medications for 8 to 10 hours a day, has eye contact and looks directly at parents when wants to communicate with them, shows interest to communicate, started to pay attention to the environment. After half year, 6 months after PSC, one more protocol consisting of MO, mite organelles, CNS, 40 vials, MO pineal gland, 20 vials, and GCMF auto, 20 vials was done. 8 months after treatment, attending regular school with additional classes, becomes more autonomous, able to dress up, is taking care of himself, gets involved in group activities at school. 10 months after treatment, further improvement, quote, learning to read and communicate better, and quote from parents, and he strives to learn at school like his classmates. Another case presentation, also a boy, 9 years old, had 2 sessions of precursor stem cells. After the first session, noted improvements in communication skills, able to hold a very logical conversation, able to maintain eye contact, and had much improved memory. After the second xenograft, better learning abilities, critical thinking, and judgments improved. Further improvements seen in his socializing ability at school and improvements in communication and ability to express himself. Patient R, girl, 17 years old. 2 PSC sessions were done. As you see, I've selected quite unusual cases, the teenagers, which are considered not easy to treat, not easy to achieve notable progress. Nevertheless, she presented with a borderline intellectual function, attention deficit disorder, limited eye contact, limited social interaction, and poor communication skills. Poor or practically no communication skills. After the targeted cell therapy, she had achieved a great progress in eye contact and interaction with others. Attention span improved. She learned to complete puzzles and various tasks, improved learning abilities, social skill improved, able to make friends and interact with her peers. Another case, patient S, boy, 17 years old, presented with similar patterns as the previous case presented, had undergone 3 sessions of PSC, improvements in social skills, language, and ability to express himself, made a notable progress in alertness to the environment, attention span, and ability to focus on the tasks. One more interesting case, a boy, 20 years old, presented with severe attention deficit, learning disability, social disability, speech and language delay, behavioral problems. Had 7 PSC sessions in a span of 5 years. Improvements noted after the second SCT, progress in memory, good in memorizing date, time and place, significant improvements in speech, able to speak in full sentences, broader vocabulary, talks more and asks more questions. After the 4th PSC session, significant improvement in cognition, can write and read in Chinese and English. After 7th PSC session, noted that cognitive skills continue to significantly improve, better language skills and speech, becoming more observant and understanding things better, especially topics that interest him, for instance, Formula One race. So as we can see from all these case presentations, that neuroplasticity and potential of the brain to develop, especially the prefrontal cortex, until the age of 25 at least, gives more room for regenerative medicine with stem cell, and hence more hope for the families, the patients, and more opportunities for the physicians to fight ASD. You can visit YouTube channel and the website of the European Wellness for more videos of the testimonials from the patients and their family members, to see more evidence of efficacy of the targeted cell therapy in treatment of neurodegenerative disorders, ASD, age reversal, and many others. So I always anticipate more questions regarding targeted precursor stem cell therapy, asking to explain all the details of its mechanisms of action and describe all the pathways through which all the beneficial outcomes are achieved. In fact, the complete mechanism of action as well as the full potential of targeted precursor stem cells is yet to be discovered and understood. But there is something I would like to share to conclude the current presentation. Franz Schmidt, Doctor of Medicine, one of the colleagues of Dr. Paul Nihans, in his book titled Cell Therapy, A New Dimension in Medicine, has reported a vast data about outcomes of treatment of over 3,500 Down syndrome children with targeted organ and tissue-specific cell therapy using fetal xenogenic cell preparations. Down syndrome is associated with distorted physical development, lower body height, and distorted body proportions, manifested by shorter and more stout body, shorter limbs, and disproportionate head circumference. That's, of course, not even mentioned in the intellectual and cognitive development and all. We're just talking about the morphology of the body. It turns out that boys treated with fetal cell therapy develop significantly less body dysmorphia than non-treated individuals and acquire physical bodily features closer to non-Down syndrome individuals. Similar effects, though somewhat less prominent, are noted in treated girls as well. I'd like to draw your attention to the astounding numbers of observations. We're talking thousands of cases that leaves no room for doubt of efficacy of cell therapy, statistically speaking. The disproportions and physical dysmorphia are significantly less manifested in Down syndrome individuals who are treated by fetal precursor cells. You can see the charts comparing head circumference in non-Down syndrome boys treated and untreated Down syndrome individuals. Similar trend is present in Down syndrome girls, as it is illustrated by the chart. After the age of 6 years old, the treated individuals acquire more of the physical features of non-Down individuals. Dr. Franz Schmidt did not provide the explicit explanation of the biological pathways and mechanisms of such effects. Even now, decades after that book was published, neither can we explicitly explain how it works. However, the results and numbers, the statistic, speaks for itself. It is clear that the topic of fetal precursor stem cells requires a lot of attention from researchers, scientists, and medical practitioners. More data, more research, and more funding is needed to spearhead and further develop this direction of regenerative medicine. Thank you for your attention, ladies and gentlemen, and I wish you all to stay healthy, be alive, and have fun.